Hey everybody, it's Summer here with Done Naturally, and today we have an Ask Summer. Biting during breastfeeding. So this happens to about every mom. At one moment, the baby is breastfeeding and they bite down. And it does not feel good at all. So what do you do to prevent it? What can you do to stop it? Why are they even doing it? Okay, so it can typically begin when teething begins, which can be as early as 3 months that they can start to teeth. And their gums are throbbing and they're in pain. And they can usually bite down with those gums and there's not even any teeth there yet, but it still really hurts. Let me first tell you what to do to get out of that situation. In that instant that they bite down, the easiest thing to do is in their nursing and they clamp down and they have a nice grip. I want you to take their head and for the briefest second, push their head into your breast. This will cover their nose, which will only briefly not allow them to breathe. And because of that, they will release, open your mouth, and you will feel better. So it's a quick second. It's a bite, push in, they let go, you bring them away. And if that's done consistently, biting usually stops. What can happen a lot of times is when that first bite occurs, mom reacts. She screams, she yelps, understandably, and that can scare the baby. And sometimes that can start a nursing strike because the response from mother scared the baby, and then the baby might not want to nurse anymore. And then we're talking about several days of resisting breastfeeding. So ideally, you have an action to do that stops the bite in the moment, and you stay completely calm, breathing, holding it in because I know it doesn't feel good, and a lack of response. That's what they need. If they're older babies, closer to that 8-9 month, they kind of respond to reactions, be that negative or positive. So if you have a very negative response and you say no and you pull them away and this is not what breastfeeding is and you can only be nice to mommy and all this, they can then think it's a game. They're getting a reaction out of you. So they, at that older age, can think that's fun. So we want no response, hold it in, push them in, they let go quickly, you then can feel better and you can restart. And the more consistent you are, the faster that will stop. Another great idea is to have teething things nearby your nursing little station or nursing nest that you can offer as a substitute. So if you've done that short little pull in and they've released and they come away, you can then offer a frozen banana, frozen peeled banana, a teething toy that's frozen, and kind of let them numb and gum on that. And then when they're done with that, again, bring them back to the breast. If you're consistent, it should work. Biting should not be the end of breastfeeding. Many babies are biting early on, and it would be unfortunate if that stopped breastfeeding for a mom. And I know a lot of moms, that's their fear, is once they have teeth, and biting, and I don't know if I can make it through that. Usually the biting happens before the teeth erupt. Some biting can still occur after that time, and of course there's now a tooth and it can do some damage, and I've had to work through with moms healing that. But it's usually a short time. If you're consistent, we can get through it and you can get over to the other side of that where you have jumped that hurdle and continue breastfeeding. So that's what I got today. You guys have a good one. Bye.